Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Nystatin. Its brand name is Mycostatin. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would give this medication to a patient, followed by contraindications or reasons we would not be able to give Nystatin to a patient. We'll then discuss some examples of dosing, and then finish it off with side effects. I've put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Nystatin binds to ergosterol, which is a major component of the fungal cell membrane. When presented in sufficient concentrations, it forms pores in the membrane that lead to potassium leakage, acidification, and death of the fungus. In terms of indications or reasons we may give this medication to a patient, we may see it used in the treatment of candidal vulvovaginitis, as well as in the treatment of candidiasis of the skin. Patients with non-esophageal gastrointestinal candidiasis may use this medication, as well as patients with oropharyngeal candidiasis. Now, candidiasis would be a fungal infection caused by a yeast called Candida. With respect to contraindications or reasons we would not be able to give Nystatin to a patient, well, we just wouldn't give this medication to a patient who had a hypersensitivity to Nystatin or to any other component of the formulation. Now for some examples of dosing with Nystatin. In the treatment of candidal vulvovaginitis, using the tablet, we may see one tablet inserted intravaginally daily for 2 weeks. With the suppository, it would be very similar. One suppository intravaginally daily for 14 days, again 2 weeks. For recurrent infections, we would typically treat for 10 to 14 days, then followed by fluconazole 150 milligrams orally weekly for 6 months. For candidiasis of the skin, a patient may use the ointment or a cream and apply liberally to the affected areas topically twice daily until the healing is complete. As with all medications, there are some side effects or adverse reactions that patients may experience while using Nystatin. We'll go over a couple of those here now. Some patients may experience skin irritation or a hypersensitivity reaction, and one more serious side effect would be Stevens-Johnson syndrome. Alright everybody, that's all we're going to talk about today with Nystatin or Mycostatin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, most importantly subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.